Member for Prince George Valemount.
The NDP have created a free-for-all with open drug use, shockingly, even within our public hospitals. A leaked memo providing direction to nurses blatantly states, and I quote, "With decriminalization, patients can use substances while they are in their hospital rooms," end quote. The entire memo is outrageous. Under this NDP government, illicit drug use, and yes, even drug trafficking in hospitals are not just tolerated, but they are endorsed. So when will the Premier put the safety of nurses and other patients first and end his dangerous decriminalization experiment?
Minister of Health. Minister of Health.
Thank you, Honourable Speaker. And there are a number of elements to the question. I know that my colleague, the Minister of Mental Health and Addictions, will be addressing it as well on supplementary. I think, Honourable Speaker, the priority of addressing the safety of healthcare workers, of doctors and nurses, of health sciences professionals in all of our healthcare institutions is a singular priority of all of us. It's critical to ensuring that we have nurses, and we have nurses in place, and we recruit and we retain nurses. It is important to ensure their safety. It's why we listened to nurses and to healthcare workers and to health sciences professionals and doctors in changing the security model in acute care hospitals more than a year ago. There were questions raised about this as to whether we would meet our targets. We said we'd hire 320 relational security officers across 26 acute care hospitals, and we, in fact, met those targets in exactly the time we said we'd do that. We worked with our nurses. These were recommendations from our community of healthcare workers, and we're going to continue to take all the actions required to ensure that healthcare workers are safe in our healthcare institutions.
Member for Prince George Valemount, supplemental.
Well, the members opposite might think about their clapping when they start listening to nurses. What nurses are saying in British Columbia is that drug use is allowed, permitted, and endorsed by this minister and this government in hospital beds in public hospitals. That's what the memo says. So the minister can talk all he wants about security guards. They're not using them. People are using drugs in hospitals. Courageous nurses are coming forward all across British Columbia with alarming accounts of daily encounters with meth, cocaine, and fentanyl use in our hospitals. Chaos and harm have been unleashed by this government, with reports of meth being smoked in a unit just hours after the birth of a newborn baby. That's what nurses are saying, and that's what's going on in hospitals under this minister's watch. How many more nurses have to be put at risk and infants exposed to illicit hard drugs in our hospitals before the Premier puts an end to this reckless decriminalization experiment?
Minister of Mental Health and Addictions.
Thank you very much, Honourable Speaker. And I want to take the opportunity in responding to the member's question to thank all of the healthcare workers on the front lines who are working across our entire healthcare system, who are in fact leading our response to the toxic drug crisis, a crisis which took the lives of 2,539 British Columbians last year, a crisis which all parties in this House met and deliberated over and agreed to a number of strategies and recommendations in order to address.
Members, it's okay. Minister will continue.
All members of this House agreed to a suite of measures upon hearing from British Columbians, including healthcare workers, advocates, public health workers, hearing from our communities about the need to come together to take measures to keep our members safe.
Members, let's listen to the answer, please.
I will say that with respect to decriminalization, which was supported by every single party in this House, with the exception of the Conservatives, who weren't at the table at the time, but all of the members all of the members in this House, in a unique moment, came together to agree to this measure.
Ma'am? Members?
Every single member of this House agreed to the recommendations of the Standing Committee on Health. And I'm going to say that
Minister, hold it. Members, there can be more questions asked after this. You can correct the minister if you so desire, please. Let's listen to the answer now. Minister.
Thank you, Honourable Speaker. What we do know is that ending this particular tool, which is one tool of many that we are using in this unprecedented crisis that we are experiencing, ending this program won't save a single life, not a single life in this province. And that is our...
Continue.
The work that we are doing across our healthcare system to protect people in our communities, to try to end the scourge that is impacting so many members of our communities is work that we need to continue to do with our healthcare system, with our partners, and we need to ensure that that work is done appropriately. And I will say, with respect to decriminalization, that it was never intended to be, it was never intended. And the objective of that program is not to promote unfettered public drug use, which is why our government has taken measures to ensure that that program is delivered appropriately. Honourable Speaker, we're going to continue to do the work to stand up for the 2,539 British Columbians who died last year from the toxic drug crisis. That's the work that we need to be doing.